Hello, everybody. This is Dr. Beltran. Welcome to this live. We'll be talking about some very interesting things. We will be talking about the LGS protocol in general, also the importance of metabolic therapy and how high dose vitamin D therapy has a very big impact in improving metabolic therapy. And also at the same time, we will be talking about how this is very important for cancer patients. So I'm going to go ahead and give you some time to be able to join in. For those who are not online yet, well, we'll give you some time to be able to join into this chat, and we can go ahead and answer some of your questions, and hopefully we can get some of these things cleared out of the way. All right. So once again, my name is Dr. Beltran. It's a pleasure to be here with you guys and be able to share some information that's perhaps very important for many patients. A lot of patients who do have autoimmunity, have metabolic syndrome, or cancer will eventually have a lot of questions in trying to find answers in regards to how to treat themselves by using the LGS protocol. Okay. So, as I just mentioned, my name is Dr. Eduardo Beltran. I am the creator of the LGS protocol. I'm also the author of the LGS Protocol book. It's available on Amazon for those who do not know me. I am an internist. I am also a dermatologist. I'm a vitamin D expert, research scientist, and we also work within the field of metabolic therapy for cancer patients. All right. So we treat a little bit of about everything from autoimmunity, everything related in relationship to metabolic syndrome, and everything in regards to cancer. All right. So it is a pleasure to be here with you guys. I hope we get more individuals participating in this live video that I'm doing at this time. Um, for those who do not know me, once again, my name is Dr. Eduardo Beltran. I'm a physician. I also work within the field of integrative functional medicine, treat autoimmune patients, metabolic syndrome, and cancer patients. All right. So feel free to ask questions if you'd like. I'm more than happy to answer them. And for those who are a little bit aware of what the LGS protocol is all about, is as the name says, is the Leaky Gut Syndrome Protocol. It's basically a protocol that's destined to treating autoimmune diseases by using a specific diet that is um, according to the microbiome profile of the patient. And also, we look a lot at the epigenetics of individuals because every individual is different, right? So basically, the LGS protocol, as we all know it, is a protocol that's based on three main pillars, right? And here we're talking about modulating the microbiome, which would be number one, two, modulating the immune system, and finally, three, modulating or, excuse me, compensating the patient's epigenetics. So, as you guys know, every individual is different, every person's biochemistry is different. Every individual has their own peculiarities, lifestyle. There are a whole bunch of different things that can influence in how those individuals develop as a person, right? And we must be aware of all of these things because they do have a big impact on the individual's life, you know. And stress, is a big component in how autoimmunity and cancer can actually develop. It's very common seeing that most of my patients, 90% of my patients who do consult with me, have a history of some form or degree of type of stress, which can have a big impact in their lives. Now, when I talk about the first pillar, in this case, which is the modulation of the microbiome, it's very important for us to recognize that the microbiome is basically the epicenter where everything happens. It is the epicenter of human health, literally. And sadly, when we go to our physicians, usually we don't see doctors looking into the microbiome. They just basically jot down a whole bunch of different symptoms, signs and symptoms. They may probably examine you if they get to examine you at one point, and then they just prescribe, a series of medications that perhaps might be able to help out with the symptoms, And you can feel better, on medications. But then again, this is just basically symptom management, right? So if a patient comes into the office and they're saying, hey, Dr. Beltran, I'm not feeling very well. Actually, I've been feeling that, I've been having some sleep issues. I've been trying to lose some weight, and I haven't been having any, luck in being able to lose a couple of pounds or kilos. And I've also noticed that I feel very fatigued. And then you keep on, doing all the questions, and then you end up finding out that this individual has perhaps, a clinical diagnoses that could suggest hypothyroidism, right, as Hashimoto's disease. Or it could be everything on the contrary. A patient can come in with, tachycardia, weight loss, excessive weight loss, anxiety, all these things. There can be hyperthyroidism, right? So, out of all of the years that I've been dealing with patients, it always comes back to the microbiome, interestingly, and then eventually the epigenetics has a very big impact on how you treat these patients. But first, you always have to look at the microbiome, right? And always, and I would say 99% of all cases, there always is an issue in regards to the microbiome. But sadly, this is something that's very overlooked by physicians, and it's something that you really need to stop down and ask questions in regards to the digestive tract. And here's where we start asking questions and saying, well, tell me a little bit about, your diet. What do you eat? And a lot of patients, might have issues, with eating certain foods, that might cause constipation or might cause diarrhea or might have a lot of bloating or might have a lot of GERD or might have, epigastric pain, symptoms such as gastritis and things like these, right? Or they might have, you know, issues in regards to irritable bowel syndrome. A lot of patients that I see have known as SIBO. Others have a condition known as SIFO, or they might actually have, another condition that can cause a lot of dysbiosis, a lot of what we call this LIBO or LIFO if it's a dysbiosis that affects the large intestine. But a lot of these individuals have a general condition known as dysbiosis. So dysbiosis basically means is that you have an imbalance of the microbiome, and when there is an imbalance of the microbiome, this will lead to inflammation. Okay. Now, things that you kind of have in mind is that whenever you have an individual who does have a certain degree of dysbiosis, the only actual real way of being able to determine to what extent and what is causing this dysbiosis is by actually looking at the microbiome itself. So, in other words, you need to actually look at the microbiome diversity. All right. And this means actually doing a GI map or any form of microbiome test that is going to be looking at certain parameters or certain bacteria that we do have in our microbiota that will be causing or any certain degree of dysbiosis, right? And things that I look at in the microbiome is, and usually the test that I like to ask for is the GI map. I'm pretty good at using that test. I look at if they have a good alpha diversity, if these patients have a lack or a deficiency of certain bacteria that are very important for making mucin, or two, if these patients have issues in regards to overgrowth of certain bacteria, such as Clostridium, or you could probably have an excess of H. pylori, or you can have an excess of certain fungus, right? Candida, or parasites, or viruses, right? So let's be taken into account what's the infection that this patient has, right? And with leaky gut syndrome. And more than 90% of most patients who do have leaky gut syndrome have a lot of dysbiosis. And if this dysbiosis is in great amounts, well, eventually this is going to be causing a condition known as molecular mimicry, and you end up developing a autoimmune condition, right? So the first pillar is always looking at the microbiome, right? The second pillar is basically looking at the immune system, see how this individual, uh, how the individual's immune system is behaving. And here's where high dose vitamin D is very essential. It's very important because it's what helps modulate the immune system, right? And there's a protocol that was developed in Brazil by a physician by the name of Dr. Cesar Gali Coimbra. He is a vitamin D expert and has been using this protocol for many, many years and has helped a lot of patients who had autoimmune conditions such as multiple sclerosis, Parkinson's, you name it, rheumatoid arthritis, and have gotten much better when they're put on a high dose vitamin D therapy. And I've been using this for many years now as well, and I've seen great results with patients, right? And the reason why this is very important is because 80% or more than 80% of patients who do have an autoimmune disease or cancer have a genetic polymorphism affecting their vitamin D genes. And usually here we see genes that are affecting the vitamin D receptor. It might be genes in the conversion of vitamin D metabolite. It might be a gene that helps in the transport of vitamin D metabolites, right? And we can't forget that vitamin D is not a vitamin. It's a hormone. And it's a hormone that was erroneously classified as a vitamin back in the 1800s. But nowadays we know that it's a steroid, right? And it is the most important hormone that regulates our immune system, right? And that's something that I just want to have to say because people need to know that we're dealing with a hormone. We're not talking about a vitamin. And that's what, a lot of people say vitamin D, vitamin D. We're dealing with a vitamin. We're not dealing just with a vitamin. We're dealing with a hormone, which is known as calcitrol. That's the actual hormone that we're dealing with. Okay. Now, this hormone, calcitrol, has a very, very potent um, metabolic activity on many genes, on many different levels. It regulates more than 10% of the whole genome, human genome. We're talking about more than 2,500 genes, 3,000 genes if we're in utero. That's a lot. That's a lot of genes. So it regulates 10% of the human genome. And very few people are actually aware of this, right? This is why when we look at the genetic testing that we do in these patients, and that's the third pillar of the LGS protocol, is that we see that these patients have polymorphisms, what we call SNPs, single nucleotide polymorphisms. So whenever I get a patient and I start looking at them, I look at three things. I look at the microbiome. I do regular blood work, see if there is, a deficiency of a vitamin, mineral, and all these things. And third, I also look at the genetics. I look at the DNA methylation pathway because we know that the DNA methylation pathway is very important for regulating your epigenome, correct? So, how do I know and how should doctors be able to determine what is the best dose for the patient? So that's the question that comes to mind, right? How do how do we know what is the best dose for a patient who has an autoimmune disease or even cancer? Well, here we have to look at the vitamin D levels. We have to be looking also at the parathyroid hormone, the PTH. And there is an antagonism between what we know as the vitamin D level, the 25 hydroxy vitamin D that we get, that we measure when we go to our physician and we ask, can you please tell me what my vitamin D levels are? They measure 25 hydroxy vitamin D, and we should also compare it with the parathyroid hormone. And let's say, for instance, if the vitamin D levels are low, the antagonist hormone in this case, which would be the parathyroid hormone, is going to be high. Okay. So there's a specific relationship. These are antagonists. When vitamin D is low, the parathyroid hormone is high. Okay. Now, as I keep on increasing my vitamin D levels, the parathyroid hormone is going to start to go down, and we want to overcome the vitamin D resistance by inhibiting this parathyroid hormone and keeping it at the level of the lower reference range. And when we are able to do that, then we can say that we actually have overcome, the vitamin D resistance that these individuals have, right? And obviously, always monitoring, with your doctor, you have to be monitoring the calcium levels, serum calcium, ionized calcium, PTH, phosphorus, and other labs as well, right? So that's the way how your doctor will be able to determine what is the ideal dose of vitamin D for you. And you can probably start off at 10,000, 40,000, 50,000, 60,000. And I have patients that take up to 200,000 a day, 200,000 international units a day. All right. And bear in mind, if we think about this, This whole international units that we use, it's kind of like there to kind of throw you off and scare you. Oh, he takes 100,000 international units. It's not that much. Really, it isn't. When we start looking into this, it's barely milligrams. We're talking about very small doses of vitamin D, but nevertheless, we as doctors have to be responsible, and we have to be monitoring, calcium levels in our patients just to make sure that they don't get toxic. Because yes, there is a possibility of causing hypercalcemia, and some individuals are more prone than others, right? Now, it's important to understand that vitamin D doesn't work by itself. It requires cofactors. And here we're talking about, magnesium, we're talking about vitamin K2, we're talking about omega-3, and many other cofactors that I prescribe in the LGS protocol. Okay. And it's very important to use these cofactors because vitamin D requires all of them in order to work correctly, right? And one of the things that I've noticed is that when I started autoimmune patients and some cancer patients, is that the moment I determine that there is intestinal hyperpermeability or there is leaky gut syndrome, we know that this excessive amount of leaky gut allows for the entry of lipopolysaccharides that are going to interact directly with your immune system. And let us not forget that 80 to 85% of your immune system is found where? In the gastrointestinal tract, in the gastrointestinal lining. Okay. And that's very, very important. That's basically where or the whole immune system is there. I mean, it's there for a reason, right? Because it's supposed to be able to filter out what's going to be nutritious and a nutrient for your body, and whatever is a pathogen, it has to keep it out, right? But the problem is that the Western diet is just overwhelming for the immune system because we just keep on putting so many, uh, you know, so much carbohydrate in the diet, so many processed foods, hydrogenated oils, a lot of sugar, a lot of lectins, right? And here I can talk about gluten, right? Gluten is made up of prolamins, and one of the prolamins that we have there is gliadin. Gliadin, once it is absorbed by the enterocyte, upregulates the production of zonulin. Zonulin goes and acts upon the tight junctions, and all of a sudden you have an increase in the permeability. So this is why it's very important for us to be able to exclude certain foods that won't increase the expression of zonulin. Now, curiously, we know that vitamin D in high doses can actually have a very positive impact in inhibiting the expression of zonulin. So this helps out in the reduction of the uh, tight junctions, right? So we're actually reducing the intestinal hyperpermeability by reinforcing these tight junctions. So, in other words, vitamin D has a very important impact on your microbiome as well because it reduces the intestinal hyperpermeability and also helps in the upregulation and production of catalycidins, beta defensins that are going to be able to fight off infections that we have in our gastrointestinal tract. And this is why a lot of patients improve from their autoimmune diseases. You see? Pretty interesting stuff. This is why high dose vitamin D has a very positive effect on your immune system. Now, bear in mind there are some individuals that unfortunately cannot benefit from high dose vitamin D because they have certain conditions such as sarcoidosis, some granulomatosis that makes them prone to hypercalcemia. So we need to watch out for not prescribing high dose vitamin D to these patients, and this is why we do a labs. We know we ask a lot of questions during the history of the patient just to make sure that this individual does not have one of those conditions that can actually induce hypercalcemia, right? And this is why high dose vitamin D therapy is done with a physician, right? You're always being monitored by a doctor, okay, or a healthcare provider. Now, when I look at the epigenetics of a patient, I'm always looking at genes such as MTHFR, right? We know a lot of these, or MTTR or MTR. We're also looking at, homocysteine. A lot of these individuals sometimes might have issues with these genes, and they need higher doses of vitamin B9 as in the methyl form, such as methylfolate, or higher doses of methylcobalamin, vitamin B12, or higher doses of vitamin B6, right? because these are vitamins that act at the level of the methylation cycle. And curiously, vitamin D as well acts at these levels as well. It's a cofactor, right? Then we have the tetrahydrofolate cycle. Right beside there, we have the BH4 cycle, which is very important for the making of the neurotransmitters such as dopamine, serotonin, correct? And all of these are very important in the whole process. So this is why I highly advise, when you do the LGS protocol, it's good not just to look at the microbiota, but also and in your lab work, obviously, but also make sure that you're looking at your genetics because every individual has different genetics. And that's the best way to be able to justify the reason why you're prescribing certain supplements more than others, right? Some people actually have polymorphisms with their magnesium genes. Some people have polymorphisms with their vitamin D genes. Some people have issues with glutathione. Some people have issues with, detox pathways. All of these things need to be evaluated by your doctor, who is an LGS protocol provider. They need to be addressed and they need to be, looked at from all of these different angles. This is why vitamin D is very important, for modulating your immune system. This is why we use diet to be able to modulate the microbiota, and we implement herbals to be able to treat certain infections that we have over there. And finally, use certain other supplements to be able to compensate some other genes that require compensation. Correct? Now, when I start talking about cancer, cancer is a fascinating field as well because we see that patients not only do they have dysbiosis in their gut microbiota, and they also have issues with epigenetics, but the reason why sometimes these cancers develop, especially if it's like a breast cancer, let's say, in a woman, and it can be, estrogen positive or it could be triple negative or you name it. But all these individuals who have cancer have a common denominator. And that common denominator is low vitamin D state, vitamin D deficiency, insufficiency, or a vitamin D genetic polymorphism that makes them prone to developing different types of cancers. And I have this wonderful book that it's right over here. It's called Vitamin D Receptor Gene Polymorphisms, The Risks for Breast Cancer. Um, every single patient that I've seen who has breast cancer has this VDR polymorphism. It's incredible. It's very, very common, you know? So this is why high dose vitamin D therapy in these individuals has a very good outcome, you see? Besides doing the metabolic therapy, besides going on the, you know, uh, ketogenic diet and doing the fasting and doing high dose vitamin C, alpha lipoic acid, hyperbaric chamber therapy, hyperbaric medicine, and all the other cofactors, and using fenbendazole and using ivermectin, and many of the other medications. But when we introduce high dose vitamin D, we have a very profound effect in killing cancer because vitamin D, as we know, is a hormone, right? And it has many different benefits. And one of them is that it induces cellular differentiation, right? It allows for the inhibition of cellular proliferation. It promotes apoptosis. It inhibits angiogenesis and it modulates the immune system. And it participates in the reduction of oxidative stress. And it also regulates autophagy. So it has a whole bunch of different um, mechanisms that actually helps out in the resolution and remission of these cancer patients. And I'm not just talking about, you know, cancer, breast cancer. I'm talking about all different forms of cancer. It's pretty cool. It's really cool when you start seeing these things, you know. And I remember seeing my first patient who had breast cancer and melanoma and adenocarcinoma of the large intestine, one of my first patients. And when I started giving these patients high doses of vitamin D, I saw incredible results, things that just were mind blowing. And the radiologist reached out to me and said, "Hey, what's going on with these patients that they're getting better? Their CT scans, their MRIs, they're just showing, that the tumor is going away and it's getting smaller." And obviously, one of the major reasons is that it's a whole bunch of it's a whole the whole protocol itself, it's very high precision medicine. And the beauty of all of this is that there's no chemotherapy involved, no radiation, no surgery, right? And usually the patients who end up coming to me are patients who have already gone through chemotherapy, have done radiation therapy, have had surgery, and eventually they come in, as a last resort. And when we do the whole workup, the modulation of the microbiome, compensation of the immune system, being the vitamin D resistance, compensating the epigenetics of the patients, doing the ketogenic diet, doing HBOT, hyperbaric oxygen therapy, doing, use of certain, repurposed drugs such as fenbendazole, albendazole, mebendazole, ivermectin, you name it, all of these medications, high dose vitamin C, right, with alpha lipoic acid. I mean, all of these therapies have a profound impact in improving health in general and also killing cancer cells in doing all those things that I just mentioned, right? But vitamin D is something, is really something. And I can't, I mean, I always remember this. It's the work of Dr. Joellen Welsh. I mean, she came out even on ABC News one day, and I remember many years ago. You can actually, I think I have a video of this on my channel, but it shows, how she was doing research in mice, giving calcitrol to these mice who had breast cancer. There, I mean, they put these tumors in situ, right, and they noticed how the tumors reduced in size. And it was incredible seeing these results. How calcitrol, the actual hormone, act as if you were giving these patients, these mice, tamoxifen, which is a medication that's used for breast cancer. So it is something really impressive. And when we lower dose of vitamin D, you start seeing the cancer trying to come back again. So it is dose dependent. I've seen these things. I've been able to determine these things. It is something really, really impressive, right? So what I wanted to say is that out of all these years that I've been practicing medicine, and seeing all these patients all over the world, one of the things that brings, gets my attention is that I believe that it's very, very important for doctors and physicians to be able to recognize the importance of high dose vitamin D therapy for cancer patients. Sometimes we hear that, oh no, but yes, we want to give them vitamin D and keep it up in the high normal references and just keep it there. But the thing is that these patients, they have polymorphisms. They have polymorphisms. These patients need much higher doses of vitamin D. This is a vitamin D receptor in breast cancer. This is a book on breast cancer, and every single patient who had breast cancer had VDR polymorphism. So this means that most of patients who do have, some form of cancer, most definitely have a very high chance of having some degree of genetic polymorphism that affects the vitamin D genes. We know that vitamin D is very protective against cancer. It prevents more than 80% of all different types of cancers. And the minute we have low levels of vitamin D, we're opening up Pandora's box to be able to develop any form of other autoimmune disease, metabolic syndrome, and cancer. So this is why when I treat patients who are undergoing metabolic therapy, one of the things I do is that I make sure that the vitamin D levels are high and that I'm inhibiting the PTH hormone. We have to make sure that PTH is inhibited throughout all of the therapy, right? And curiously is that the moment I dropped in some of my patients the vitamin D dosage because I didn't want to cause any hypercalcemia, tumors start to grow again. And that's something that's pretty impressive. I mean, I said, whoa. So if I drop the dose of vitamin D, cancer starts to grow back. So this means that it is dose dependent. We have to make sure that we're giving a high dose that is going to inhibit the PTH, make sure that there's no calcium toxicity. And if there is going to be calcium toxicity, make sure that patient's on a low calcium diet. This is why we develop, criteria that are published on our website, for high dose vitamin D therapy, which tells us how much calcium an individual must be consuming based on the type of the amount of vitamin D that they're taking. All right. So these are the criteria that are posted on our website. If you guys want to go check it out for free too, it's www.spims.org. You'll be able to find that over there. Okay. So to sum up everything once again, the LGS protocol is a very high precision medicine protocol destined to treating not only autoimmunity, metabolic syndrome, but also cancer. When we do treatment, we apply these same pillars, which is modulation of the microbiota, 2, modulation of the immune system, 3, compensating the epigenetics of the patient, right? When we modulate the microbiome, how do we do this? Through ketogenic diet, Fasting, prolonged fasting, some days, sometimes some patients might be doing 24 hours, 72 hours. And in some cases, we can inclusively do up to a week of fasting, but this must always be under medical supervision. All right. And make sure that the patients are taking their supplements. The day that they are doing their fasting, I tell all my patients, you can stop taking your supplements the day you're doing your fasting. When you're doing fasting, the only thing you can actually take is just water, some green tea, and a little bit of coffee if you want some. Okay. So if anybody has any questions, feel free to ask questions if you'd like. I'm more than happy to answer them. Um, I don't know. I think I'm I'm pretty sure that people are going to be connecting uh, down the road through here, but I hope the information that I brought out today is something that might enlighten you guys and perhaps maybe educate you on certain topics, that I have a great passion for. I think very few doctors do what I do. There are very few doctors that do what I do. And it's hard to find people that actually use a very safe approach in treating all of these conditions. Usually conventional medicine goes a very different route. So if you enjoyed this video, please give it a thumbs up. Thank you for being here and participating. Hope you guys enjoyed it, and make use of it. I'm more than happy to do another live like this one next time. All right, see you guys until next time. Bye bye.